COVID-19 cases continue to rise exponentially. We'll have details to this story and more in the national report. With the details to the news for Tuesday, September 7th, I am Rikisha St. Louis. The number of COVID-19 cases in Grenada continues to rise exponentially. Statistics from the Ministry of Health reveal that as of 9 p.m. on September 6th, the island recorded a total of 1,473 confirmed cases. During the past week, the number of new cases ranged between 78 and 281 daily, with 231 new cases recorded on Monday. At present, there are 1,194 active cases, with only 9 of these being imported. Females account for the majority of the cases, 54%, with 46% being males. Those who have tested positive for the virus range in age from 2 months to 92 years old. The majority of the cases are persons between 18 and 60 years of age, with 10% under 18 years and 6% above 60. The Ministry of Health reminds persons that while the vaccine will not prevent persons from contracting or spreading the virus, it reduces the severity of any symptoms and lessens the likelihood of hospitalization and even death. COVID-19 cases have been recorded in all parishes and on the sister isle of Carriacou. 14 cases have been recorded in Carriacou thus far. A total of 1,194 persons are currently in isolation, having had some form of contact or exposure to a confirmed positive case. A further 560 persons are in quarantine. The Ministry of Health is continuing its vaccination program, administering the 2 vaccines which are available locally. Acting Permanent Secretary in the Ministry responsible for hospital and community health services, Hannah Julian St. Paul, during Tuesday's post-cabinet press briefing, said over 19,000 Grenadians are now fully vaccinated. She shared a breakdown of the vaccine administration.
At present, there's 27,046 persons have received our first dose vaccines and 19,482 persons has received the second dose of vaccines. Therefore, they are considered fully vaccinated. And if I were to share with you a breakdown of the percentage of persons vaccinated within our parishes, St. George's has a percentage of 72.9%, St. Andrew 8.4%, St. David's 3.8%, St. Patrick's 5.2%, St. John's and Mark 4.6%, while Carriacou and Petit-Martinique has a 5.1%. To date, we have conducted over 62,370 PCR tests.
Comparatively, Grenada has one of the lowest rates of vaccination among CARICOM member states. Statistics published by the Caribbean Public Health Agency, CARPHA, in late August shows St. Kitts and Nevis at the top with 39%, Antigua and Barbuda with 34%, Barbados 32%, and Trinidad and Tobago and Dominica with 28%. 4 countries are recorded with rates lower than Grenada: the Bahamas, St. Vincent and the Grenadines, Jamaica, and Haiti. Health and Social Security Minister Honorable Nicholas Steele says Grenada has enough PCR swabs to conduct tests as the ministry's aggressive PCR COVID-19 testing continues in light of the community spread of the virus. Minister Steele said the country has the ability to conduct 17,000 PCR tests. So far, Grenada has spent $17 million to procure machines, test kits, and reagents for testing since 2020 when the virus was first detected. The health minister explained that the quantity of swabs available is enough to be distributed to various facilities currently assisting the ministry in mass testing island-wide. He said additional test kits are regularly procured to ensure continuity in the ministry's test drive. To date, Grenada has conducted 62,307 rapid test PCR tests.
The number of tests currently, PCR tests, I can give you a straight out answer, but let me explain a bit. PCR tests in particular, it's a chain of various things that you need to make sure you have enough of each. So me telling you the number of reagents and telling you that we can do over 300,000 tests there is not the realistic picture. That's how much reagents we have and how much tests can be done at the lab. But each of those, the sample needs to be taken from that nasal swab. So that is right now where we are at our lowest numbers within that system, and that is 17,000. So we have the ability to do 17,000 PCR swabs. So that means 17,000 PCR tests, although we have much more reagents, etc. So yes, there are more swabs on the way that will allow us to continue the constant flow.
Rapid antigen tests are also being used to confirm COVID-19 cases. Minister Steele told members of the media on Tuesday during the post-cabinet press briefing that recently, due to intensified testing, the ministry has doubled the use of rapid tests.
It gets tested at times like these, where we are seeing a significant drop and have had to make sure that additional orders and emergency orders are placed, is in the rapid tests. As you're very much aware, we have shifted and are using considerably more, almost 1,000 times more rapid tests over the last week and a half. So that also has to be increased. We have in the past, when we did not have a high demand, we have shared some of our tests with neighboring islands when they were in their time of need. And we are also requesting from them just to make sure that we keep that buffer in place as best as possible.
This is the National Report. The news will continue after the break.
This is a message from the Ministry of Health. If you or a family member suspect that you may have contracted COVID-19 and are displaying symptoms, please immediately self-isolate at home. This means that you must also avoid all contact with other members of your household. Do not visit hospitals or health centers, as this creates the potential for further spread of the virus, and it puts additional persons at risk when you come into contact with them. Your best course of action is to call the COVID-19 hotline at 458-4787 or 538-4787, or contact your nearest health center or medical station. Once your information has been received, health officials will come to you. Help prevent the spread of COVID-19. This has been a message from the Ministry of Health.
Continuing the news, the Ministry of Health says further adjustments will be made to services offered at the General Hospital and various community health facilities as the sector continues to grapple with the effects of COVID-19. The rapid rate of community spread has impacted the health sector, with over 60 in mandatory isolation due to exposure to COVID-19. Director of Hospital Services, Dr. Carol McIntosh, said Tuesday a decision has been made to scale down some of the services being offered to cushion the effects of having so many health workers absent from the job. The significant increase in confirmed COVID-19 cases is forcing operational changes in various sectors. At Tuesday's post-cabinet media brief, Dr. McIntosh said services will continue, but on a smaller scale. Dr. McIntosh gave the assurance that although the workload has increased and the ratio of patients to to healthcare staff is much more, administrators have taken additional steps to maintain the well-being of healthcare staff.
When you're talking about for the doctors and nurses that are able to oversee for the isolation wards and making sure that they manage the COVID patients. As it relates to the ancillary and auxiliary staff, of course, we've always understaffed, but we continue to provide as best we can across the board in all the services. The clinics at present, we're lessening the amount of services that we're able to provide, as well as increasing the amount of time, so 12-hour shifts that we're allowing. So for those who are in the auxiliary and ancillary, that would allow for them to be able to provide the services with a lesser number per day, and then also allow for them to rest in between. For the doctors and nurses, the same thing. We're putting less services in and going more on emergency services so that we can pull people in as necessary to provide the immediate services that are necessary. We're not stopping services to people. We keep talking about COVID-19, but remember, we have our regular admissions, patients, deliveries, emergency surgeries, which will continue.
Acting Permanent Secretary in the Ministry of Health with responsibility for hospital and community health services, Hannah Julian St. Paul, said the community clinics and health facilities have also been affected by the number of positive COVID-19 cases among staff. She said the services offered at the clinics will be merged to avoid frequent visitation and reduce exposure to the virus, particularly among the elderly.
Our community nursing department currently has 13 nurses that are being affected by the disease and cannot be able to provide service at this point in time. And that also has impacted the community health services and resulting in us have to take some actions there as well in order to continue the services within community health. And what persons would be seeing in the week ahead is that we have to scale back on some of the services that are offered within community. So our maternal and child health service, vaccination program, our pharmaceutical services, we are now looking at how do we merge some of these services together. So whereas persons used to access these services on different days, we are trying to merge these services so that when persons go to the health service, to the health facility by appointment, on the day given for your appointment, you can access several of these things one time. And that would help with the exposure as well, because we don't want persons to be coming to the facility as often as they used to, especially our elderlies. So we also are putting some systems in place as a result to have our elderly persons managed at home, persons with chronic illnesses. So we will be increasing their supplies, like the medication and other supplies that they access at the facility, which would reduce the number of visits they have to be making to the health facility, as well as allowing the limited staff that we have to be able to serve the community.
The ministry continues to commend staff at hospitals and community health facilities for the service they continue to deliver despite the added stress brought about by COVID-19. Health and Social Security Minister Honorable Nicholas Steele is high in praise for the entire health team, and he's optimistic that under the guidance of the current team of doctors and nurses, that Grenada will get through this difficult period.
At this current rate of spread, our health system will be tested to the max. Will be tested to the max. I cannot think of a better team I'd rather have for that test. But unfortunately, for that team, these are going to be very dark and difficult days ahead of us. But the team will come through. Let me say again, I cannot think of a better team to have than the team we have now. Whatever our challenges are, this is the right team to get past it.
Assistant Commissioner of Police Jesmond Prince says police presence will be heightened throughout communities as the state of emergency continues. He said as of Friday, September 4th, officers were deployed in several communities to increase foot and vehicle patrols. The increase, he said, will assist the government and the Ministry of Health to keep track of events and activities being held that pose a possible threat to the further spread of the virus. According to ACP Prince, access through checkpoints will only be granted to individuals with identification card or authorized passes from the RGPF.
Accessing passage through these roadblocks require every person, to have an access pass, which would be issued by the Royal Grenada Police Force. In the regulation, there are listed a number of essential workers. And if you are belonging to any entity, any company or institution, and that institution has an ID system, we are expecting and anticipating that you will have that ID system with you when you are accessing the checkpoints. If you are without an ID, accessing these checkpoints could become very difficult, because the only way that we can identify you as being an essential worker is through some form of identification.
He encouraged drivers and workers to use the passes for the intended purpose. ACP Prince explained that measures are in place at checkpoints to record ID and vehicle numbers for future use.
You're not going to be using your ID to bust a line. And the reason for that is because every time you cross a checkpoint, that ID and yourself, vehicle number and all of that will be recorded. And so if for some reason the checkpoint supervisor realizes that you are not looking as though you are officially from duty or officially going to duty or to perform some essential service, that will be recorded, and a check will be made against your management to know that whether or not on that particular time and so on of the night, whether or not you are on official engagement for your company. So please, we are trying to avoid and to keep this thing under control, and we are asking everybody to use the system that is in place to ensure that no one is exposed unnecessarily to this situation.
That story just ended the national report for Tuesday, September 7th, recapping the top story. COVID-19 cases continue to rise exponentially. On behalf of the entire news and production team, I am Rikisha St. Louis saying thank you for joining us. Until next time.